Dietary interventions like intermittent fasting, IF, and fasting mimicking diets, FMDs, are poised to become central pillars of mainstream anti-aging strategies, driven by compelling human data and the growing appetite for non-pharmaceutical approaches to health span extension. Unlike continuous caloric restriction, which is notoriously difficult to sustain, these periodic protocols aim to activate the body's ancient stress resistance and repair pathways without requiring perpetual deprivation, making them far more practical for widespread adoption. Human trials of fasting mimicking diets, such as the well-known 5-day plant-based low-protein, low-calorie cycles, have demonstrated reductions in markers of biological age by an average of around 2.5 years, as measured by DNA methylation clocks. Participants in these studies have also shown improved insulin sensitivity, reduced inflammation, lowered blood pressure, and beneficial changes in lipid profiles, clear signs of a systemic reset toward a more youthful metabolic state. Intermittent fasting regimens, whether through daily time-restricted eating, e.g., 16:8 windows, or alternate-day fasting, produce many similar benefits, including enhanced autophagy, increased mitochondrial efficiency, and improved immune cell rejuvenation. Collectively, these findings provide strong mechanistic and clinical evidence that periodic nutrient deprivation taps into deeply conserved longevity pathways, such as activation of AMPK, suppression of mTOR signaling, and induction of sirtuins, molecular switches that orchestrate cellular repair and stress resilience. Because these diets offer profound metabolic benefits without pharmacological intervention, clinicians and preventive medicine practitioners are increasingly recommending them as accessible strategies for patients interested in slowing aging. Unlike emerging therapies like senolytics or gene editing, dietary interventions require no specialized equipment or prescription, making them broadly scalable and cost-effective. Moreover, fasting protocols can often be adapted to cultural, religious, or personal preferences, further enhancing their appeal. In the near future, we are likely to see fasting and fasting-mimicking diets integrated into personalized longevity plans, guided by wearable devices and digital health apps that monitor glucose dynamics, ketone levels, or even circulating senescence markers. AI-powered nutrition platforms will tailor fasting schedules to individuals' circadian rhythms, hormonal profiles, and real-time biomarkers of metabolic stress, optimizing protocols for maximal benefit while minimizing risks like muscle loss or hormonal imbalance. However, individual variability remains a critical consideration. While many people respond to intermittent fasting with significant improvements in metabolic and inflammatory markers, others may experience fatigue, menstrual irregularities, or unwanted weight loss, especially in the elderly or those with underlying medical conditions. Long-term adherence is another major challenge. Periodic fasting can be socially and psychologically difficult, especially in food-centered cultures or for those with histories of disordered eating. Addressing these obstacles will require robust patient education, culturally sensitive counseling, and the development of more flexible fasting-mimicking programs, such as periodic partial fasts or personalized caloric cycles that balance effectiveness with sustainability. To support widespread adoption, food technology companies are developing specialized meal kits and shelf-stable fasting-mimicking foods designed to precisely replicate the metabolic effects of fasting while improving convenience and palatability. This could make adherence easier for busy individuals or those who struggle with meal planning during fasting cycles, broadening the accessibility of these interventions beyond highly motivated biohackers or longevity enthusiasts. Socially, the normalization of fasting as a longevity practice may spark cultural shifts in how society views meal timing and snacking. We could see workplace and school schedules gradually adapt to accommodate intermittent eating windows, and insurance incentives may emerge for programs that document metabolic improvements through periodic fasting. In the long run, as more rigorous studies confirm fasting's ability to extend health span and delay diseases like diabetes, cardiovascular disease, and neurodegeneration, these dietary protocols could move from fringe wellness trends to core recommendations in clinical guidelines for aging and chronic disease prevention. Altogether, fasting-mimicking diets and intermittent fasting are on track to become foundational, non-invasive tools in anti-aging medicine, offering a powerful way to harness the body's innate regenerative capacities through the simple act of not eating, strategically and temporarily. With continued research, better personalization, and solutions to the barriers of compliance, these interventions could help millions slow the ticking of their biological clocks, adding years of healthy, vibrant life.